Good afternoon. We're here today to talk about the opiate epidemic in our community, strategies to address it throughout the North Country. I'm Mundy. I'm the President and CEO of CVPH Medical Center, and I'm joined today by Dr. Kent Hall, Chief Medical Officer and Emergency Room Physician here at CVPH. If you look at the addiction of our country to opiates, it's gone up tremendously in the past 3 or 4 years, as you can see from the graph in front of you. If you drill down further, you can see in 2010, opiates were related to addictions at 57%. By 2014, 68% of addictions were related to opiates. And by the time we got to 2015, we're at 73, and I would dare say, just from the media reports that you see and the other anecdotal stories, we're well above that today, which is just a staggering number. In the North Country, you can see the opiate deaths across our region, and we know that these are very much underreported, and it's more likely the floor than the actual number, as we lack a single repository for that data. In the emergency visits related to that, you can see in Clinton County, dramatic increase from 15 to 16. Essex County and Franklin County in 15 were suppressed for confidentiality, as there were only 6 discharges at that point. And we know anecdotally that in 17 we've seen an increase as well. If you look around our community at some of the fallout from this, and I listen to John Bernardi talk all the time about the struggle and the work that United Way is doing around the foster families. We have over 100 children in foster care, and 40 of those are direct results of their parents having an opiate heroin abuse. On average, Clinton County files 200 abuse neglect petitions in family court, and almost over a third, almost 40%, are related to substance abuse issues. And our caseworkers spend significant amounts of time working with those parents, the providers, foster parents, and most importantly, the children on those issues. And the cost is huge to our community, estimated at over $1.5 million. So you can see it's a big issue. If you talk to law enforcement, the impact on them is tremendous. Robberies, assault, burglaries, larcenies, driving under the influence, and so on. You can see the things that cause that. And all you have to do is talk to a police officer about their past week work, and you know that they've encountered this. Since 2010, our state police Troop B has investigated 93 fatal drug overdoses. In 2015, Narcan, which is the drug that reverses an opiate overdose, in some patients, was administered to 13 people with 12 saves. In 16, 12 and 12. And in 17, 8 times with 7 saves. So you can see it's very important. At this point, I'll turn it over to Dr. Hall to talk about how we address this issue.
Yeah, thank you, Stephen. So I am lucky enough to work with a number of people on what is called SPARK. SPARK it's an acronym. It stands for the Substance Abuse Prevention and Recovery Coalition of Clinton County. What you see on the slide in front of you is the list of people who comprise the SPARK Steering Committee. And as you can see from that list, they really span the gamut of individuals and institutions within this community. So it's not just healthcare, it's not just social services. It includes legal. It includes providers of rehabilitation. It includes the legislators in our region. So it really is the kind of the coalition that came together in November of 2015, really because of the absolute pervasity of the opiate epidemic. So you can see that our mission from SPARC is to foster community health through education, prevention, treatment, and the recovery from substance abuse. I will tell you that SPARC thought long and hard about whether we should have opiate in our name, and we decided not to, because we understand that while opiate is what is here now, we don't know what it's going to be in 5 years or 7 years. Just as 5 years ago it wasn't about opiates, it was about meth, and it's always about alcohol. So our goal is through prevention to provide outreach and educational services to all the county school administrators and educators, and we provide we have provided two community-wide educational events. For intervention, we are promoting syringe exchange through the Alliance for Positive Health, and also multiple medication drop boxes. And we're also looking at local utilization and the impact of Narcan. And then when you look at treatment, we have actually restored substance abuse assessment and educational services to the Clinton County Jail that were cut off in 2008 because of decreased funding from New York State. We're deploying peer recovery coaches in the emergency department here at CVPH in conjunction with county social services such as Champlain Valley Family Center. And we are developing community resource handbook and a phone app that I will talk about later. Recovery, we are trying very much to glamorize recovery and to get rid of the stigma which follows opiate addiction. We have convened or are in the process of convening a roundtable of local employers so that they can participate in the SPARC efforts, and that actually will be happening later this month in October. And we are looking to sustain our coalition efforts through Billy Jones' efforts. We have actually gotten us an amount of money from New York State that will help us to move these efforts forward. And we're looking for grant funding as well. So what you see on this slide is color-coded, and it really is the SPARC goal matrix for 2017. What you see in red, it shows significant progress. In lighter green are those things that we have started, and in darker green, those things that we have completed. And so you can see that we're actually moving along. There are still obviously areas that we need to focus on, but that's what we've been doing. So as an example, I talked about the community productions. We showed in April of this year Chasing the Dragon, which is a 2016 production from the FBI Academy TV studios that was made in association with the Drug Enforcement Agency. So Chasing the Dragon is a 48-minute documentary that basically talks through vignettes from 5 to 7 people who have gone through addiction, and it basically talks about what their journey is and what their journey has been like. And what I will tell you that what I took out of that, what really struck me almost viscerally was that when you hear what these people were like as kids and as young adults, they were anybody. They were you and I. And they got turned on to and addicted to opiates, not because they were predestined to based on genetics or based on what their family life was like. They were normal people, and something just happened, just as it could happen to you or I. the school presentation was given to, we actually started it at Peru. We gave it to the middle school and to the high school students, and then to their parents in the evening. It was emceed by Chris Peters, who's the Director of Legal and Social Services, and a number of Spark Steering Committee members were there, along with Jason, who is a recovering addict, and Officer Chris Clark from the Plattsburgh City Police Department. You know, it was wonderfully received, and I will tell you that to reinforce what I said earlier, one of the students from, one of the senior students from Peru High School went back, and they were having a conversation in their school that was being mentored by and facilitated by their teacher, and one of the students stood up and said, if you don't think that you know somebody, if you think you don't know somebody who has been hit by this, then you're just kidding yourselves, because it's a family member, it is a neighbor, it is the student sitting next to you, but there is somebody that you know who has been affected by this. And it was just so really both heart-wrenching and warming to have a student stand up and feel comfortable after seeing this movie to actually have that conversation. You know, in April, after the Peru presentation, we then did it at the Strand, where there were about 1,000 community members who were there. And again, it was just wonderful to see the people respond to Jason, to respond to the members of the panel who were there to answer questions, which included Connie Willie. It included Mike Carpenter, who's the CEO of the Northeast Group and who's been spearheading the employer endeavor. We also had a mother and daughter who talked about the loss of their son and brother from after fighting addiction for up to 15 years. We have subsequently had presentations at many of the local schools, including Beekmantown, Saranac Lake, Plattsburgh Middle School, again with Jason and with Officer Chris Clark being the primary people there to answer questions from the students. And that was all last spring. In this fall, we've had Chazy, BOCES, and NAC partner with Spark as well. So it's really been wonderful. And I will tell you that Jason and his partner brought their baby daughter into the world in early September, and it's just wonderful that he has made that movement. What we're doing here at CVPH is that the emergency department now offers Narcan kits to patients who come in with overdose or with concerns about opiate addiction, and that these kits, while offered through the emergency department, also offer a tie to the Association for Family, that's Alliance for Positive Health. You know, and that allows them to then go back and to get refills on the Narcan kits should they be used.
Thanks, Ken. If you look across our communities, 1 in 5 adults have some type of mental illness, so that's 18%. 1 in 11 have a substance abuse disorder. So, you know, in your daily interactions, we all interact with people, whether we know it or not, who have these afflictions. Yet only 50% of these people receive treatment. And when you then peel it back and say, okay, what does treatment look like? It's so many different things. This is a struggle for everyone, but if you look at this, healthcare, and we talk about this here at the hospital, healthcare really only affects a smaller portion. It's critical, but a small portion of health outcomes. And we know that people's behavior has a tremendous effect on their health outcomes. And genetics has a huge impact, and environmental. But the other one is social circumstances. So does someone have housing? Do they have adequate food? Do they have a job? Those type of things. And we really have to understand the societal impacts on your health outcomes. If you then look at behavioral health, we're working to connect our emergency department, our acute care services, physician practices, and community agencies. I was just this afternoon touring our family medicine center where our residency is, and saw 2 new offices there that are for the patients there to meet with mental health practitioners. And it's a nice segregated area for patients there who need to speak to someone to receive treatment in that, and it was just a very nice, and by all staff reports, very, very well received by our patients. We have a joint relationship with behavioral health services. We created a leadership position that's shared between CVPH and BHSN. This was intended to bring our organizations closer together and align our efforts in the same direction. We've also been working on recruitment with the University of Vermont Medical Group. And in the past, we've had 2, 3 psychiatrists that support our inpatient services, and Behavioral Health Services North has had 1 or 2, and we've all struggled in our own ways mightily to provide staffing for this critical service. And the University of Vermont Medical Group came forward with a plan to recruit 8 psychiatrists for our region. And the plan was for 3 to be in the inpatient setting. That's inpatient psychiatry, 1 for inpatient consults on our medical floors, and 1 to provide resources to the emergency room here at CVPH. And the second phase of that is to add 1 to Hudson Headwaters to serve their 2 offices in Champlain, and soon to open at our plaza next to Hannaford's, and 2 that we would provide to behavioral health services. And I'm pleased to say that this summer we credentialed the first 5, which was our kind of the first phase of this plan. And we're already well on our way interviewing and looking to make some offers to bring in and be fully staffed by the end of this year, the end of this recruitment year, which is June, for the entire 8, which will be really a record for this area, and provide a cohesive look at this region. The vision that we have for behavioral health services is to fully embrace the medical village concept through providing pathways for patients that bridge the inpatient and outpatient worlds. And a medical village is just what you think of when you think of a village of being a conglomeration of different entities coming together and living in the same place. And it's no different for a medical village, and that's bringing together all the different services and coordinating them. And ours would have a regional triage hotline, a mobile crisis team, which is new and through BHSN, support crisis stabilization and 23-hour observation unit, and then intensive transition teams to make sure that people who come into the one entry point into the system transition their way through the system. And this will be a dramatic step forward for our community. In our unit here, today we have an adult mental health unit with limited integration and many stops within the system. We have 22 beds. In the past, we were capped at 12 due to the provider shortages, but with the recruitments that I mentioned before, we've been able to take the cap off on those beds and really serving more people here locally. And it really focuses only on inpatient and does not have any what's called a warm handoff. So, having someone from outpatient come into the inpatient setting and introduce someone and really transition across. In the future, and we're under construction now, we'll have that fully integrated medical village with the variety of services in a one-stop shop, be located on the 6th floor, and coordinated care in a more seamless fashion from inpatient to outpatient. We'll have space for post-discharge and outpatient transitions. We'll ensure that a patient has a primary care physician or health home follow-up and follow-up psychiatric visits. And we'll connect with the outpatient pharmacy for medications right here on our campus, so someone won't have to walk out of our facility and say, well, how do I get to the pharmacy, or I don't have any money. We'll work that out here before they leave. And finally, we'll have a patient navigator for behavioral health services. It'll kind of be the provider of transition, and will be that provider of the warm handoff between inpatient and outpatient services. As an employer, we have a responsibility as well, and for over 10 years, we've been working with our staff to help facilitate detox or inpatient treatment, and then work on how they can come back and be productive members of our workforce and colleagues. And our Occupational Health and Wellness Center works with these employees as they are set with New York State Disability and FEMLA to ensure they have the appropriate time off. We're pleased to say that in all the cases we've worked with, they've come back to the job they left. Some over time have gone on to take other positions either here at the organization or in other organizations, but they made the journey back. And we've worked very closely with NASNA and their statewide peer assistance program. And every week on our campus, there are meetings of AA and NA available in our conference rooms to the public. And those are, and we have some staff members, some of our colleagues that work in these departments. So Kent, maybe if you would just give us a little bit more about what employers out in our community can do and are doing.
So what I would say, what employers can do is really in two different areas. The first is what you can do for your employees themselves, and that really is to create a support network with the community resources before they are needed. Know that people will have issues, but they won't know what to do and they won't know where to go. So if you can, in some location, provide a list of the local resources that are available in our community, including the times and the locations for different types of meetings, whether it's AA or NA or Al-Anon, and then educate your employees really on an ongoing basis, at least annually, and during the general orientation about what those available resources are. I would also say it's important that you create an alcohol and a drug abuse policy that really provides guidance for your directors and your supervisors, so that your employees, so that they understand what their responsibilities are for carrying out the program. And it's very important that you educate all of your staff to recognize someone who is under the influence really of any substances, through a change in behavior, a change in their appearance, the way that their speech changes. You can understand that people who are recovering from addiction are good workers. This is the second thing, is understand that these people are good workers. Again, I would reflect you back to Jason, who was on the panel for our Chasing the Dragon presentations. He's articulate, smart, and he wants to work, and he's been given that opportunity. But how often do we have that innate bias, that visceral reaction, I don't want to get involved, I'm concerned that this is going to be bad for me or bad for my business? The reality is that if you show them support, they could very well be the best workers that you have. What you're seeing here is the website that's on the New York State .gov website on different resources that are available to you or to anyone really. You know, it's about Governor Cuomo's task force, you know, a kitchen table toolkit. What can be better than to be able to talk to your kids or to other family members about what this addiction does and what addiction is, and wouldn't it be great to be able to have those conversations and to listen to them. Again, I go back to that senior in high school at Peru, just being able to open up and to have that in a conversation, and also to recognize what those warning signs are. I would also say to get involved locally. So if you're in Clinton County, I strongly encourage you to become part of Spark. You can find us on Facebook. If you're in Essex County, then there is ECHO, the Essex County Heroin and Opioid Prevention Coalition, and you can see where their website is there. And if you're in Franklin County, then you become part of the Franklin County Prevention Task Force. We're all in different stages. We all have different strengths. We all have different weaknesses, both in terms of the locale that we have as well as the resources that are available to us. But I strongly encourage you to become involved there. Finally, what I would refer you to is an app, because there's an app for everything. So there is an app both on the Android and the Apple App Store that's called Routes to Recovery. This is a fantastic app that has been developed through the Clinton, Franklin, and Essex library system by one of their interns. And when you go on this and you download it, then you can actually find resources to help in almost any area, whether it's mental health, substance abuse, food and clothing, housing, and this app drills down to where it will, if you allow it, then it will know where you are, and it will give you a map to where you can go for counseling. It can give you a map to where you can go for food or for housing or how to get transportation. I mean, it is truly an all-encompassing thing. So I definitely encourage you to get that, to download it, to show it to your employees, and to make sure that they have that available to them as well.
So, Kent, that was really interesting. And from the time you started talking about that app, I opened my phone, and I hadn't downloaded it. And I went to the App Store, downloaded it, and now I've opened it. And it lists all the different mental health care providers that have walk-in availability, substance abuse throughout the region. One of the things I just want to mention is most of the things that we talked about here were focused on Clinton County because those are many of the things that we're involved in. Our colleagues in Essex County and at Elizabethtown and Franklin County through Alice Hyde have equally done tremendous work on this. And this app really involves all of that. And I would encourage you just to take a look at this and familiarize it. If you're listening to this and you've got someone in human resources, this would be a great resource to bring to their awareness, because we always ask, what can we do? I think the most important thing is just what we've done today is to begin the discussion about it and talk about it. Either Ken or I would be available to talk with you at any time. Feel free to reach out to us. My email is smundy@cvph.org, and Kent's is...
And mine is khallmd@cvph.org.
And either one of us would be happy to speak with you. I'd like to take the time to thank you for listening to us speak about this, and look forward to more discussions on how we can deal with this tremendous crisis with opiates in our community. Thank you.
Thank you.